So I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you to our Advocacy and Public Policy webinar today, Navigating Your Care and Treatment, a Medicare Example. So with that, I would like to introduce Marla Feinstein. Marla is a graduate of Boston University. She also did graduate work in physiology and molecular biophysics. And Marla, as long as I've known you, reading this today, actually earlier, I learned all of this about you that I didn't know. She was awarded a National Institute of Health Predoctoral Training Fellowship, has an MPH or a Master's in Public Health and Health Policy from Columbia University, and formerly was a consultant for the New York State Governor's Office and Department of Health. She's currently the Senior Policy and Healthcare Analyst for the National Hemophilia Foundation and has been instrumental in advocating for bleeding disorders at the national and state level. And really, I have to say that when Medicare issues come up, and I get contacted by a community member who is having a difficulty navigating Medicare or has a problem, she is the first person I reach out to. And so I'm thrilled to have her on today to be able to share that expertise with all of you. And we also have on today Randy Curtis. I think a lot of you folks in California especially know Randy and what an advocate he is for the bleeding disorders community. He's a past president of the Hemophilia Council of California and has done a lot of work in terms of hemophilia research and quality of life measures. And we appreciate him joining us today. So towards the end of the webinar, he will share a little bit of his experience and may pop in to ask a question or make a comment here and there through the presentation. So with that, I will remind everyone that, as questions come up, please feel free to type them in the chat and we will get to them at the end. And we look forward to hopefully what I know will be a very informative presentation for all of you. So Marla, I am going to turn it over to you.
Excellent. And thank you guys for inviting me. Thanks to the council for, actually promoting Medicare, which is a refreshing change. Next slide, please. Just in case anyone hasn't seen this, this is NHF's updated mission statement. Next slide, please. And I'm just going to get to the heart of the matter, which is Medicare. We're all here to listen about Medicare. And as you've probably seen on television, Medicare is also a hot topic, whether it's open enrollment, whether it's drug pricing. Medicare is always a hot topic. Well, in my very, very small world, it's a hot topic. Okay, what is Medicare? Medicare is broadly a federal program, right? It provides health insurance for those 65 and older or those under 65 with certain disabilities. For example, if you have Lou Gehrig's disease or ALS, you can qualify for Medicare without a waiting period, and any end-stage renal disease. Whoever the policy people were that advocated for end-stage renal disease, 2 thumbs up because they're excluded from everything. But what the heart of the issue is that Social Security actually enrolls people in Medicare. Most people don't know that. So when people ask questions about enrollment and disability qualifications, those are all very separate from the Medicare program actually. Right? Those are the enrollment people, and that's done through Social Security Administration. CMS, the Center for Medicare and Medicaid Services, is actually the program or the agency that deals with coverage, benefits, payments, and all of that kind of jazz with Medicare. What is important about Medicare is that you have to be a U.S. citizen or lawfully present in the U.S. and must reside at a minimum of 5 continuous years. If you don't meet those qualifications, you will not be eligible for Medicare.
Marla, thank you so much. This was super informative and helpful. I want to also thank go ahead.
Sorry, before you thank this, so you'll send out the open enrollment in California 2022 fact sheet as well as the slide deck, correct?
Correct.
Because there's a lot of really great. It has a link to the handbook. It has all these important dates and deadlines and when things start. It gives you a lot of specifics to California about the Medicare Savings Program and the number of plans offered in your state and what percentage, blah, blah, blah. So
Yeah, we'll send that out to everyone who registers.